Hello, Dr. Cliff, your movement recovery specialist, and welcome to a new series we're calling What Is? Almost every day I have patients that ask me questions about common medical conditions or exercises, and the goal of this series is to give simple answers to those frequently asked questions. So, grab your cup of coffee. Today I'm drinking Coffee Cult Dark Roast. I'll put a link up here. Over here, somewhere at the top. I did a review on it a few months back. It's pretty decent. Comes from South Florida. But the first question today is, what is arthritis? There's literally over 100 different types, so we're not going to get into that. That's a bit confusing, and more time than we want for this video. But there's two main types of arthritis. There's something called osteoarthritis, or you'll see it written as OA, and rheumatoid arthritis, written RA, and a lot of medical notes and such. Osteoarthritis is your typical wear and tear, I'm old, whatever that is, 50, 60, 90, so I have some arthritis. Rheumatoid arthritis is a little bit different. It's a autoimmune disease that typically affects people much younger and can be much more debilitating, although in the last decade or so we have a lot of new treatment protocols, mainly pharmaceutical based, that seem to have really been life-changing and limit the disability that people, back in the 80s or 90s even, had associated with rheumatoid arthritis. So let's focus on osteoarthritis. What actually happens? Well, any type of itis is a inflammation. So osteoarthritis is inflammation of the bone at a joint. Let's say that you have a ball like this, right? This could be either your hip or your shoulder, because they're both ball and socket joints somewhat. Shoulder is not quite, but we'll say it is for this example. And then you have a socket that sits around it, like so. This whole surface should be nice and smooth, and this whole surface in here should be nice and smooth, and they just roll on each other. Now, over years of wear and tear, maybe you have an accident where you fall and whack this hard, or a car accident where it gets jammed up against here. You can get areas that aren't so nice and smooth anymore. They start to look bumpy like this. So now this bump will wear, and if there's any cartilage covering here, it wears off, and now you have bone rubbing on bone, which becomes inflamed and very painful. That's osteoarthritis. What do we do about it? Well, that could be a whole nother video, but one of the main things that you can do is strengthen the muscles and stretch the muscles around the joint so that there's less stress on that joint. If you have any questions, please leave them down in the comments. I'm happy to answer them. Also, if there's other what is type questions you would like to have answered, leave those down there, and I'll make videos on those as well. Until next time, remember, life is a strength sport, so get stronger and get living.